Hello and welcome to the program today. I'm your host, Neal Howard, here on Health Professional Radio. Our guest in studio today is Dr. William Harris, here to speak about omega-3 fatty acids as president and CEO of OmegaQuant. Welcome to the program, Dr. Harris.
Thank you for having me.
Thank you. Now, you're currently a professor in the Department of Medicine at the Sanford School of Medicine at the University of South Dakota and president and CEO of OmegaQuant. Exactly what is OmegaQuant involved in?
Yeah, OmegaQuant is a laboratory, analytical laboratory, and we specialize in measuring blood levels of omega-3 fatty acids.
Okay.
So that's the principal goal of this company.
Now, you've been working to establish the Omega-3 Index as a type of potential biomarker for cardiovascular disease risk. Is that correct? How's that going?
Yeah, right, for about the last 10 years.
What was it that prompted you to try and develop this index?
A couple of studies that have been published, one in 1995 and the other one in 2002, that were both told the same story, and the story was that people that had higher levels of red blood cell omega-3 levels, the omega-3s that segregate themselves into red blood cell membranes. So higher levels of omega-3 fatty acids in the blood, in the red cell, were associated with reduced risk for sudden cardiac death. And again, this was shown in two completely separate studies, and the same effect was seen in both. And in the late in 2002, I and a colleague, a cardiologist from Germany, were simply at a meeting, talking with each other, thinking that, this red blood cell omega-3 test really ought to be something that doctors measure, because it means something. It is very much like a risk factor for particularly sudden cardiac death. And so we both set out to establish the Omega-3 Index as a risk factor for heart disease.
Is it something that can be determined that it's a genetic thing, or once it develops, is that when this biomarker is readily seen?
It's pretty much driven by how much omega-3 fatty acids you eat.
Okay.
The amount that's in your blood. We look at populations around the world. The Japanese, for example, eat probably almost 10 times as much omega-3 as Americans do, and their omega-3 index is twice as high as ours is. There are vegans, people who eat no omega-3s at all, have much lower levels of EPA and DHA, which we'll talk about in a minute. The fish oil omega-3s, they have very low levels of omega-3. And when they take omega-3 supplements, their levels go up. So it's really driven a lot by how much EPA and DHA you actually eat.
Now, you're talking DHA and EPA. Are these two different types of omega-3s, or are these the only two types, or just the types that we are focusing on?
Those are the two types we're focusing on. Those are the two that are found in fish and fish oils. There's another kind of omega-3 that's found in plant oils, particularly in flaxseed oil. But that doesn't, as far as we know yet, have the same effects as the other ones that are in fish.
You spoke of certain populations eating, say, 10 times more omega-3s, say in the United States. We're talking about Japan. Are these omega-3s found in these high concentrations in just places that are in close proximity to huge water sources and lots of fish? And what about the people that don't eat fish or don't like it or can't eat it?
Right, exactly. Just being close to the water doesn't get it into your mouth. You have to actually eat the stuff, eat oily fish. And we're talking about oily fish like salmon, mackerel, herring, sardines, anchovies, if you like anchovies. Those are all oily fish, and they have quite a bit of omega-3. Albacore tuna is a good source too, really better than the chunk-like tuna. But all these are just part of the traditional diet in some countries, Japan particularly. But China, which of course has a huge coast with the Pacific Ocean, they don't have very high omega-3 levels because it's just not as much part of their culture to eat fish as much. So it's driven by a cultural, it's driven by how much you eat, and that's driven by culture a lot of times.
Now, you mentioned the oily fishes. Are these the only ones that supply this type of omega-3, or are we talking about less omega-3s in the less oily fish, or no omega-3s in those fish at all?
Less. There are. I don't think I can think of any seafood product that has zero omega-3.
Okay.
They're all better than hot dogs in that regard.
Yeah.
If you know what I mean.
Yeah, absolutely. Now, you mentioned plant-based omega-3s as another type of omega-3 as opposed to EPA and DHA. What is the difference between plant-based omega-3s and those that we're talking about found in these oily fish?
The plant-based, chemically, they're different. Of course, a fatty acid is a long chain of carbon atoms with bonds between them. The plant-based omega-3 has 18 carbons in its chain, and it has 3 double bonds, so we call it 18-3, and it is an omega-3 family, which is a certain structure. So that's the plant-based, 18 carbons long, 3 double bonds. The 2 that are in fish oils, EPA and DHA, have either 20 or 22 carbons long, and they have 5 and 6 double bonds. So they have different physical properties, different chemical properties than the plant-based omega-3. So really flaxseed oil or the plant-based omega-3 is not really equivalent to the fish oil omega-3s.
Now, is OmegaQuant only involved in this type of testing, or do you do other types of testing at the laboratory as well?
We focus only on fatty acid testing, not just omega-3s. We measure trans fats in blood, trans fatty acids. We measure saturated fats, monounsaturated, omega-6 fatty acids. And we do it for researchers around the world. We do it in blood. We do it in breast milk for lactating moms who want to have more omega-3 for their baby. So we do it in a variety of sample types, and we do measure a variety of fatty acids, but we are in that just world of fatty acid analysis.
And where can our listeners get more information about OmegaQuant?
Go to our website, which is OmegaQuant.com, O-M-E-G-A, and then Q-U-A-N-T, like quantity, quantify. OmegaQuant.com, and you learn a lot more about what we do.
Right.
People can order a dried blood spot-based Omega-3 Index test if they want to.
From the website?
Yeah.
Right. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio this afternoon with Dr. Bill Harris, the founder and president and CEO of OmegaQuant. He's been with us in studio today discussing his work establishing the Omega-3 Index as a potential biomarker for cardiovascular disease risk. It's been great having you here in the studio with us today, Dr. Harris.
Thank you, Neal.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to this podcast on iTunes.